Welcome to Doctor to Doctor. If you're a dental patient recently told that you need to have gum treatment or gum surgery or extractions, or if you're a doctor or caregiver, tonight's program is going to be very important to listen to. I am Dr. Reid Winick, dentist and founder of Dentistry for Health New York in New York City. We're going to talk tonight about a new model of dentistry called sustainable dentistry. Sustainable dentistry looks at the mouth and the body as a whole for treatment. We found that by following these sustainable principles, the mouth can heal on its own. We're going to first start discussing something called chronic inflammation in the mouth. The reason why this is so important is that about 30 years ago, I was diagnosed with something called Crohn's disease, which is a chronic inflammation of the intestines. And for 15 years, I was treated by conventional medicine with medication, and I had numerous surgeries. I was on disability and pretty much near death. And conventional medicine wasn't working. And I had to find a better way. So I came across these sustainable principles, which I'm going to discuss with you today, and how to deal with the chronic infection that you can have in your mouth. So we're going to start off with, if you have a chronic infection in your mouth, it's important to have a way to diagnose that this infection is there. Because if the infection is there, then you can identify it and then you can treat it. It's very similar to if you have a chronic infection in your tonsils. What happens is you go to your doctor, and before he treats it, he wants to do a culture to see what kind of bacteria exists in the area of your throat. And if there is bacteria, then he knows what needs to be done. Well, we follow the same principles in our sustainable dental office. And the reason why we call it sustainable dentistry is we like to take a proactive approach as opposed to a reactive approach to your overall wellness. So we're not going to sit back and just wait for the disease process to take hold. We're going to teach you sustainable principles so that your mouth and your body can heal on its own. You know, we use the word sustainability, which I'm sure you've heard about in terms of how the earth needs to be sustainable. Similar to a tree that doesn't get the right amount of water, if the water is deficient in minerals, per se, what happens? The top of the tree starts to die. Well, the same thing happens with our bodies. If we don't give the body the proper nutrients that it needs, and the proper minerals, and the proper amount of water, and the proper amount of nutrients, and good food and exercise, we start to see breakdown in the mouth the same way we saw breakdown in the tree. See, the earth is an ecosystem. Well, the body is an ecosystem, and the mouth is an ecosystem in the body. So by applying the same principles to the earth, we can actually sustain our body. So let's give some examples. So you have a chronic infection in your mouth. I suggest that you find a way to identify the infection. And once you know that you have poor bacteria or bad bacteria, then it has to be addressed. Because what happens if you do a simple test for this bacteria and you don't have the bad bacteria, but your mouth is still falling apart and breaking down, and your teeth are getting loose? Well, then maybe you have a nutritional deficiency going on. That also should be addressed. So my first point is that any infection in the mouth needs to be addressed. And the same thing with cavities. How tired of you going to the dentist and being told you have another cavity? Well, if you follow sustainable principles, for example, if you address the pH in your body and in your mouth, and you make sure your pH is at the right level, your teeth will actually not get decay and will actually heal on their own. So these principles really are very important in terms of not just your overall health, but your oral health. Now, why is this so important that I'm also addressing the medical community about this? There's something called the oral systemic connection. And basically, research has proven out over the last decade or 2 decades that there is a link between the infections, the chronic infections in the mouth, and certain diseases like heart disease, diabetes, inflammatory cancers, preterm birth, some lung problems. So many of your physicians are treating you for these chronic conditions. Say you have diabetes or you have heart disease. And it's so important that you get clearance from your dentist using these tests for bacteria so that the work you're doing with your doctor will be more effective because you're getting rid of a chronic source of infection in your teeth and in your gums. So some other principles would be, we just discussed good nutrition, the good pH, using the right medicament to remove the bacteria in your mouth. In our practice, if somebody has gum disease and they have pocketing, the first thing we tell them to do is stop flossing. Flossing doesn't work when you have an infection in your mouth. We would recommend, in addition to the other suggestions I made, using like a water irrigating device. So it's really important that we start to take a different look at our oral care and realize and ask the question, if I have this infection in my mouth, the first of all is why? There's got to be a reason. The second thing is ask, well, what is this infection doing to my overall health? Because if you have an infection in your mouth and you're a diabetic, you have a harder time controlling your insulin levels. So there's such a close relationship between your mouth and the rest of the body that it's so important you address it. I want to thank you for joining us today. It's been a pleasure talking to you. I am Dr. Reid Winick.